Welcome to Enzyme Safety Module 5, where we will cover medical surveillance. This module is the fifth and final module as part of the IFF Enzyme Safety Training Program. We encourage you to view each module consecutively. The learning objectives for this presentation are to understand the purpose and main objective of a medical surveillance program, along with its various components, qualifications needed to complete medical testing, and to review the evaluation guidelines that help to determine outcomes based on findings. There are four main objectives of a medical surveillance program: to protect the health of employees, to identify potentially sensitized workers, to provide specific guidance on work practices, to avoid future sensitizations, and to evaluate control measures. Medical surveillance testing can identify workers who have become sensitized during stage 1 prior to symptom onset and progression to allergy-induced occupational asthma. The overall goal of the medical surveillance program is for early intervention and identification at the sensitization level where the employee does not experience symptoms. This information will help to prevent workers from developing allergy symptoms from repeat exposures because early intervention will be put in place based on the results of the medical surveillance program. There are three main elements in an enzyme medical surveillance program, which is recommended annually for individuals working directly with enzymes. The first element is the Employee Health Questionnaire, which helps to establish a baseline of overall worker health and identifies if there are any occurring symptoms that may impact the ability to work with enzymes. Next is a pulmonary function test, otherwise known as spirometry, which measures lung function. Finally, allergy tests are used to identify if a worker has been sensitized to a specific enzyme. A physician or qualified medical professional should administer this program and conduct all testing and review. The purpose of the Employee Health Questionnaire is to identify and report existing symptoms. The questionnaire is filled out initially and annually and is used to document symptoms. It is also used when considering risk management strategies and should be conducted by a medical professional along with the spirometry and immunological tests as previously mentioned. A reference for the Employee Health Questionnaire can be found at the AISE Guidelines for Safe Handling of Enzymes as reference. The next part of the medical surveillance program is spirometry, and this is a lung function test that is completed using an instrument known as a spirometer and is an acceptable standard procedure. A minimum of 3 trials should be completed to check for reproducibility. The results are evaluated by a trained medical professional and are an important part of the overall medical surveillance program. The purpose of the immunological test is to monitor for sensitization. Employees who have been sensitized to a specific enzyme will show an immune response if presented with the enzyme antigen. There are 2 types of immunological tests that are available for determining sensitization. The first is the skin prick test, which is a common allergy test, and the second is a serological test such as the RAST, UNICAP, or ELISA test. The skin prick test methodology involves the enzyme antigen solution being placed on the skin. The solution is developed by selecting an enzyme used in the workplace. Results are compared to a positive and negative control. The negative control that is used is typically saline, and the positive control is a histamine. A positive test results if a wheal and flare of a specific size is present on the skin after 10 minutes. A trained medical professional is needed to evaluate the results. When evaluating results, if there are no findings, then no actions are needed. However, if there's a positive test but no symptoms, a risk assessment is needed to identify causes of exposure and to implement controls. If the spirometry test results in impaired lung function, further medical assessment is needed, and the employee should be retested within 1 month. Finally, if the employee questionnaire identifies clinical symptoms, a medical assessment should also be conducted, and the employee should be retested within 1 month. Based on the combination of medical surveillance results, the employee may need to be removed from the work area until further enzyme findings are conducted. In summary, the medical surveillance program consists of 3 key areas. The medical surveillance program can identify workers that have become sensitized and can help prevent advancement to respiratory allergy or occupational asthma. The medical surveillance program is an additional tool to help establish a safe environment when working with enzymes. Together with enzyme monitoring, the results of a medical surveillance program can help to inform risk management strategies such as engineering controls, work practices, and use of personal protective equipment. It is important that you reach out to your enzyme producer if you want further information on the medical surveillance program and how to establish one for your organization. As a recap, the first learning objective was to understand the main objectives of a medical surveillance program to be used for early intervention. Next was to learn about the various components that make up the medical surveillance program and the qualifications needed to complete the medical testing. Finally, how to use the results to determine actions needed to minimize the progression of health symptoms by using the data to help implement controls to minimize exposures. This concludes our session on medical surveillance and our overall module series on enzyme safety. If you have not already done so, we do advise that you access each module of the enzyme safety program so that you are familiar with all of the key pillars to managing enzymes safely in your work environment. Thank you.